Hey everybody, this is Erica Mello, and welcome to Tough to Treat podcast episode number 32. And this is a really interesting patient of mine. I know I say they're always interesting, but they are. And I think that's why Susan and I do this podcast, because we really love to talk about tough to treat and complex patients. So this is a young girl I treated who returned to me for a different symptom. And I think that when patients return to see you, it's an honor, right? They trust you, they formed a bond. These are people you want to keep in touch with. And I think that it's important, as I say, we are lifespan practitioners. If a patient comes back to see you for a different issue, as I said, it's an honor. And you owe it to them to really perform a really good differential diagnosis when they come back again. So this particular girl came back with posterior thigh pain. Who gets that at 12? Persistent for 2 months. I treated her over the summer for bilateral knee pain. This second time she came back, it's a different issue altogether, and I think that we need to really offer that patient another thorough evaluation, another think out of the box evaluation. And that's the beauty of our profession. We are experts at clinical reasoning. We are experts at movement. And if we can treat these patients, we will broadcast our value to the masses. So we really hope you enjoy it. If you have not yet subscribed or left a testimonial for our podcast, Susan and I would really appreciate it if you would do so, wherever you listen to podcasts, whether it's Stitcher, iTunes, Spotify, Google Play. It would mean the world to us if you could subscribe and leave a testimonial. So also, if you're on our list, you must have gotten emails about my new book, which I launched 2 weeks ago, called Why Do I Hurt? Discover the surprising connections that cause physical pain and what to do about them. And I really wrote it to empower the patient with persistent pain. And if you have any questions about the book, my website for the book is called ericamello.com. It gives you links where to purchase it. There's a sneak peek and I think a sample chapter of the book. And they're basically stories of real patients of mine who've had very typical symptoms, foot pain, knee pain, back pain, neck pain, etc., but with atypical sources to the problem. And I wrote it for the patient, as well as the physical therapist, who have persistent pain and cannot find a solution to their problem. And it's really meant to empower that patient so they can take control of their bodies and really advocate for themselves in our healthcare system. So I hope you enjoyed. If you have any questions about it, please feel free to email me. So enjoy the podcast, and we'll see you on the next episode. Thanks a million. Bye. Hey everybody, this is Erica Mello, and I'm with my co-host Susan Clinton. How are you, Susan?
I'm well. How are you?
I am good. We are recording this in October, beginning of October, and we've had so much rain here in New York, and I'm looking out my window, and half the city is beautifully bright, and the other half the city is raining. So it's one of those with the hurricanes.
And I'm sitting in northern Michigan looking across the St. Mary's River at beautiful fall colors this morning.
I'd rather have your view. I would definitely rather have your view. You want to get right to it?
Sure, let's do it.
Okay, so this patient, so I'm going to do a double thing here. So there's a young girl that I'm treating. I'll give you her background. I saw her over the summer before she went to Italy. She was going on I have a lot of patients who go to Italy, it seems, for the summer. I treated her, she got better, but she came back recently for something else. So I'm going to give you the background of the summer issue very quickly, and then I'll go into the issue she came back to see me with. Okay, so bear in mind she's 12.
Okay.
So over the summer, I would say mid-July, she came to see me with bilateral knee pain, right greater than left. It's typical for a young kid who plays sports. Aggravating was, walking, running, jumping, the usual up and down the stairs. And what made her feel better were some sort of off-the-shelf inner soles that she had. And I was like, oh, Okay, there we go. And no major past medical history, just some lactose intolerance and things like that, according to her mom. And she's had a history of knee pain for over 2 years. And I think she just started to do a lot more running and playing in in the park over the summer. And her prior recreational history was gymnastics and ballet. No surprise there.
Mm-hmm.
And she was in her house a lot over the summer after school, after she had a performing arts camp, and she would stand barefoot without the inner soles, and that would also make her not feel great. And her max tolerance for pain was about 5 blocks. And that's kind of not normal for a 12-year-old. So
Mm-hmm.
typically, I'm going to go through this quickly because I want to get into what she came in next for. So typical, I did the assessment, hypermobile, the whole thing. I just did some joint mobility assessment on her lumbar spine, just because I do that when I see people who are young kids who are really hypermobile. The extension, the foot, everything was just loosey-goosey. The foot was hypermobile, full, hyperextended knees, the hips. I think she was retroverted, I wrote down here. Of course, she had, tight hamstrings. Thank God something was holding her together. And I had her just do some lunges and squats, and she was really all over the place, honestly. And what I noticed most was her poor foot control. So I'm just going to jump in because I did treat her just for a few visits, and I ended up working. I felt that based on my assessment, that when I neutralized her foot, as in several other podcasts that I've mentioned with some patients of mine, when I neutralized her foot, everything felt better. Her standing, her walking, her squatting, her lunging, and I felt that her pelvis was secondary. She was very sort of all over the place in her pelvic control,
Mm-hmm.
which is not unusual, right, Susan, for some kid with 12 years old who has bilateral patellofemoral pain, right?
Right,
So
right.
yeah.
That's the general presentation I see in young dancers and gymnasts.
Mm-hmm.
That
Mm-hmm.
everybody heads straight to the pelvis first and
Yep.
tries to monkey with that. But you really need to, I just find that going to the feet first kind of helps set them up for a different proprioceptive experience from the base up.
Right,
Mm-hmm.
exactly. And I would highly advise that for anybody who sees that type of patient population. And so what I did was, she had some Pilates equipment at home. I ended up taping because her inner soles were really kind of worn down, and they were really not, they're a bit flimsy. So her right foot was worse, and she was a little gun shy with tape. So I taped her right foot, just gave her a navicular lift tape. Uh, I've mentioned it before on the podcast, and it just gave her some support. She felt a lot better. She had like a Wanda box at home, the piece of Pilates equipment. I gave her a very small range of motion, push downs, just easy things that she could do at home.
Mm-hmm.
And I gave her foot control. I basically had her do some toe heel, backwards walking, and then I also had her put a red band around her, TheraBand around her knees, and just do some backwards walking and forwards walking just for foot control. That's what I did the first visit. Okay,
Mm-hmm.
and so I thought,
So with the TheraBand, you did it like for like kind of monster walking type thing?
yeah,
You
yeah, but I
have her
made it
flex,
tight enough so she didn't have to, so she
really
was
go wide. Yeah. Okay.
correct.
Got it. Got it. Good.
Correct.
Yeah. Mm-hmm.
Just to just wake up the glutes a bit. And it was really more for the foot, but since she was so all over the place, I felt like I needed to rein her in with some TheraBand. So that's what I did. So I felt the foot was the primary issue, pelvis was secondary. I treated her for, let's see, July 16th. I treated her for 3 visits. And basically I did I got her on the Pilates equipment. I did some foot control again. I had her against the wall just doing some easy heel raises in without going into that inverted position, really, even if she could just do just halfway up. I did that. I did some foot control on the Pilates reformer. I had her do a one-legged stance on the Bosu, just a lot of things that were just more foot control, but
Mm-hmm.
incorporated the full body. Okay.
Mm-hmm.
She went to Italy and she was good. She felt pretty good, no problem. And I had contacted the mother when she got back, and I asked her how this girl was doing, and she said, good, she's fine. She's playing volleyball now. I'm like, volleyball? Of course, volleyball, the worst sport for your knees. And she's cutest little thing, not a real tall girl. So anyway, with this kid's schedule,
in New York, at any school. This is hard to get places after work. So anyway, I saw her last week, and this was like a one and done type of visit because her, she plays volleyball, and so she was complaining of a left hamstring ache. Okay, so bear in mind, it was both knees, right worse than left. This was her left hamstring. Her knees were pretty good. She said it flared up once in Italy, but she was playing she's playing volleyball, and she was doing pretty okay. No major knee issues, which is a shocker because I'm thinking, oh my God, he's going to come back for that. But no, she was okay. So in my interview with her, I mean, I'm looking at her and I'm not seeing any kind of major bruising. It was like she didn't tear her hamstring or anything. And I questioned her, and knowing her background, I don't know what you think of Susan, but I'm not, because I treated her foot for her knees and pelvis. I sometimes, like, when you see someone who comes back, their background, but I try to pretend they're a different person so I don't get biased by what I did last time, right? Don't you do that as well?
Well, sure, and especially in a 12-year-old, because they are a different person.
Yeah.
That they're growing at a phenomenal rate of speed. It's not like an adult who, okay, I saw you a couple of months ago and here you are. It's, kids grow fast and change, and her activities have changed and her stresses have changed.
Yeah,
Definitely.
No, for sure. So I said to her, and she's so cute, she's a real sweet thing. I said, what's bothering you now? She's like, my left hamstring hurts, and it's been bothering me for probably, I would say, what did she say, a couple of weeks now, 3 weeks? She had a prior history of a hamstring issue 1 year prior, okay?
Mm-hmm.
Resolved on its own, kids heal quickly. So I'm looking at her, I had her stand, and I'm chatting with the mother, and I'm like, I don't really see anything. And stand, I mean, I'm not touched her yet. I sat her back down, and then I said, did you fall? Any major issues? Did you fall? Any trauma? She's like, oh yeah, I had a little rib incident. I'm like, what do you mean a little rib incident? You're 12. You don't have little rib incidents. And she said, and the mother's looking at me. She's like, oh yeah, that's right. She's like, yeah, I was doing gymnastics and tumbling with my friend, and I fell onto my neck. I'm like, oh my God, help us, And this was literally like 2 months ago.
Mm-hmm.
2 months prior, so you figure. And the hamstring pain started probably a month after that. But
okay.
So, I mean, she literally, I was trying to have her describe the fall. It's like, yeah, we tumbled, then my neck hit, and then my side hit. And I'm like, well, your bum had to hit at some point. And I believe it was on her left side, which was the side of her hamstring issue.
Mm-hmm.
Either they were freaking out. They ended up taking her to the pediatrician to make sure she didn't break a rib, or, they x-rayed her neck, and she was okay. She had a hard time taking a breath, and that's why they took her to the emergency room,
Mm-hmm.
and the pediatrician. So she basically had some rib bruising. That was it. And she said she feels better now. That was all gone. She said her ribs are fine. She could take a deep breath. She's playing volleyball. She's fine. She ended up seeing an osteopath because they live downtown, and location is a big thing here in New York, because of the traffic. So she saw the mother sees an osteopath occasionally. So she took her daughter to see the DO, who, from what they told me, with this hamstring issue, did a long axis distraction, grade 5, on her left leg, and made her worse.
Oh my. I'm sitting here with my mouth wide open going, no.
I know, right? So I was like, oh. And so just based on that, because I think it's very telling, her history, and I'm like, I have a bazillion things going in my head. So based on that, what do you think?
Well, the first thing that came to mind when you were talking about a 12-year-old who is been a dancer and now is launching into volleyball and other things, is my question is has she started her period, and where is she with her long bone growth? Because the hamstring thing is not atypical, especially since she had one a year ago. It's not atypical of a situation of the bones growing faster than the muscles can keep up with.
Right.
So then you have that on top of somebody who tends to be, have a lot of joint mobility, and oftentimes the hamstrings are one of the muscles their brain will choose to overactivate to keep them kind of pulled together, right? So you've got
Yep.
an overactive hamstrings in a long bone growth spurt population. So that was my first thought. Then you layered it with the trauma.
Yeah.
And, she hit hard enough, her neck and her side to bruise her ribs. And it makes you kind of wonder, just upper cervical, if that's kind of thrown her off a bit.
Mm-hmm.
And, although she's healing and healing well and doing things like playing volleyball, I'm just wondering if perhaps maybe it's kind of moved her, kind of positionally just enough to have her really fire off one hamstring a lot more than the other, enough to really bother her.
Yeah.
Because with volleyball, you have to lean over and pick up the ball. You've got to do this. You've got to, there's a lot of things that are occurring. So if it was more long bone growth, it would be both legs. But if it, seems like it's over on one side, and I think you did say her right one a little bit, but mostly her left hamstring. And so I didn't know if you had the opportunity to take a look at her from side to side, one-legged stance, one-legged squat, going up and down on her toes, certain movement aspects, high level, because she is kind of a high level mover. The other thing and I know you have a bajillion things going on in your head, but the other thing is what happens in volleyball is she right-handed.
She is right-handed.
Yeah. So I'm thinking about the left side perhaps maybe overusing certain muscle groups to stabilize the right-handed serve.
Yeah.
So the left, leg planting in and maybe some over hamstring use to allow the serve, to give that serve some power.
Yeah. So I'm actually doing it here. Yeah. So for sure. So it's interesting. So I did not ask about her period. That's a very good question. I
just wondering where she is in her growth cycle, because that can affect,
So it's interesting. Thing. She's very short. And when I saw her in July for the first time ever, meeting her, and I'm just looking back at my notes, and the mother, I asked about a growth spurt, and I don't think she's had one, and she didn't look any taller when I saw her 3 months later. And usually with kids like that, you see, changes, but she still looked kind of small. I mean, not abnormally so, but she didn't look like, I remember my niece is 15. I mean, you could see, my God, like the growth spurt on her, but with her, not so much. So I don't think she's got to had her period, she could have, because she is rather small. The mother is small as well.
Yeah, she may be there.
Yeah. So those are good questions. And so what I ended up, I said to her, I just took a brief look at her in terms of just the standing, and the iliac crest on her left side was really elevated. I said, that's probably why the DO pulled the leg, because osteopaths believe in like these upslips and they'll pull the leg, and it was still higher. So I said, ultimately that's probably why she did it. Okay. And obviously it didn't help. So after I explained to them why the long axis distraction made her worse, because, obviously they're going to see this upslip, and that's fine, but it didn't really help. So I ended up having her bend forward just because I wanted to see if that hamstring was pulling in a lumbar forward bend. And it did, obviously. I expected that to bother her, and it did. Right up at the ischial tuberosity, almost like right up on the insertion. I had her stand on one leg, and she was pretty good with that.
Okay.
Which was a bit surprising given the history in the summer when she was completely all over the place. And I had her do like just a little bit of a lunge, because I saw her do that over the summer. I said, let me see if she can stabilize. And she actually was better. I think maybe the volleyball was helping her. So I had her do some backwards lunging, forward lunging, just to compare the level of control from 3 months ago. And she was actually okay. Didn't think was going to bother her hamstring, and it didn't. So in the assessment in standing, I don't go into too much of these sort of biomechanical abnormalities in children, and they're not really abnormal. It's just who they are.
Mm-hmm.
But I'll look and I'll saw a little bit of the rotation to the left in the pelvis. I saw, the thorax rotated to the right. Okay, whatever. Normal for kids, normal. Okay. But I didn't really harp on that like I normally would do if somebody had a persistent issue and they were much older, because she's too young to develop these habits. And
Right.
she'll have strategies, but she'll easily, get out of them because she's hypermobile and because she's young and
Mm-hmm.
she's growing, neurologically as well as physically. So I didn't really play into those findings too much with her. And so what I ended up doing after I did the one-legged standing, the lunging, I didn't see a ton. I had her, for some reason, I just said, just get on the table. And I did a slump test on her just because I felt that with the fall, she hit the head, the whole nervous system was wound up. She was completely stretching
Exactly.
that dural tube.
And the long leg distraction made her worse.
Yes, exactly.
Which is like what's happening with that. Yeah. Mm-hmm. Mm-hmm.
And guess what? It was positive.
Uh-huh.
And so I'm like, okay. So I played with the head position, raise your head,
Mm-hmm.
lower your head. Oh,
Mm-hmm.
playing with the neck position makes it much better. Of course it does. So then what I actually had her do, which was interesting, I don't do this a lot, I had her sit up into full extension in sitting, and I just had her straighten that left leg because, without going into that sort of slump position.
Right. Mm-hmm.
And it actually felt better.
It made her better. Good.
Right.
Good.
So she was truly having a hamstring issue. I don't believe that would make her feel better. Right?
It would actually make her worse because you're putting the hamstring more on a link tension relationship with an anterior tilted pelvis.
Exactly. So full slump made her worse, neck position made her better, extension slump, I'll call it, made her feel better. And so then I got her on the table and I just checked her straight leg raise. Of course, she's stiff and it was bothering her. I had her go on her tummy and I poked around the hamstring. I hate to use the word poke, but I was sort of assessing the hamstring. Sacrotuberous ligament went into her left side of her lumbar spine, hypermobile, same as, back in July. I had her do a prone hip extension. So the hamstring's going to bother her and she has a lack of power going upstairs. This thing's not going to go up off the table. Well, it flew up off the table. No problem with that. Resisted hamstring. Bilaterally, I had her do glute max, had her bend the left knee, lift the thigh up. No problem, no pain. Zero, zilcho, nada. Okay, I went in again to palpate deep in the muscle. Nothing. I got nothing out of her. And I'm like, this is not a hamstring problem. This is just not a hamstring problem. And I said to the mother, I explained to her, I said, if she had a real hamstring, because I've torn my hamstring, you can't lift that leg up off the table. This is posterior thigh pain referred from, I believe, the nervous system. It's a nervous system, like a dural issue or neural tension, probably from her fall. I don't know what you think, and I'll tell you what I did. Go ahead. What do you think?
So with you doing this stuff here, the power outage that's occurring in the hamstring is not a lower motor neuron type of thing going on. It's not a peripheral nerve deal. It's not a nerve root. It's not behaving like a nerve root. Maybe a little bit it is because of the slump test, but if you could change the head position and change the slump, it kind of makes me think dural too, like, oh, you're lifting it up, and so that's taking, the dura is moving in some different directions. So I'm beginning to wonder if she had a little sensitization of her dural sheath from the fall. And that's, you pull on that with that long leg pull test and make it worse. Ow.
Yep.
So there could be something that, set up as a bit of a sensitization, and it just, for whatever reason, happens to be symptomatic along the left hamstring. It could have very well been symptomatic along the left arm, triceps or biceps area, or something like that. And it just kind of picked picked that part of the lumbar spine, around the dural stuff there to be sensitive. That's very interesting.
So what I ended up doing was I actually went in, I checked her neck because because she's 12, I don't like to mess around a ton, but I had her just do some easy sort of nodding of the head, axial extension flexion, straightening her legs out, lower trunk rotation, just to see if I could feel any pulling under my hands. And there was a little bit, not a lot. not a lot, to be honest, but it
Mm-hmm.
was, so when I had her, excuse me, I had her do an active straight leg raise in this position just because I had her in supine
Mm-hmm.
on her left leg, and it bothered her at the end of range just because it was pulling on the hamstring.
Mm-hmm.
So I ended up taking some tension off the neck in the supine position, and I had her actively do the straight leg raise again, and she felt better. She was going further, still getting at the end, but she was going much further. So I explained to her that changing the position of the head and the dura, and explained this to her mom, that I believe this was the main issue, and it was from the fall.
So
And
when you say that you changed the position of her neck, did you traction it? Did you just
no,
flex it? What you
no,
extended
I
it?
extended it. Yeah, upper
Yeah.
cervical extension.
Yeah, that would
Yeah.
make a lot of sense. Good. I
Yeah.
just want to be sure everybody out there kind of understood that too. When you go into extension, it's just a little bit, you're like not pulling on that whole posterior membrane and dural sheath as much as you if you went into flexion or traction.
Correct.
Mm-hmm.
So once again, I'll just say supine, she was flat, legs were completely straight. I was at the head of the table. I don't usually use a pillow with neck, but I probably had one. I don't remember, to be honest. Little bit of extension, upper cervical, had her
Mm-hmm.
do the leg up, and she was much better. So that indicated to me that, and plus all the other tests, the prone hip
Mm-hmm.
extension, glute mat, and I wasn't reproducing anything.
Mm-hmm.
Only time I reproduced her lumbar forward bend, which we know winds up that whole system,
Right.
the slump test, and a lot of the things with the neck. So I ended up giving her, because she was, a couple things, because she was playing volleyball. I saw her on a Columbus Day, actually, so she had a day off, so she wasn't playing. And I gave her some little, honestly, little sort of extension slumps to do, to take the, with playing with her head position at home. And then I gave her things lying on her back, and just, once again, hip flexion, dorsiflexion, and had her do a little knee extension, knee flexion, playing with their head position, and
Mm-hmm.
not like looking up towards the ceiling, but just not in that fully retracted chin tuck position. I had her do that, and she was fine with that. So I gave her, supine, hip flexion, dorsiflexion, knee extension, knee flexion. I had her do a little bit of hip adduction, just with her head in neutral, nothing, and she felt okay with that. So I gave her that, and then I had her just sit up in full extension, just easy slumps. I mean, like 30 degrees, nothing crazy. And because she was playing volleyball the next day, I ended up putting a piece of tape. People are going to laugh because I tape a lot, but I don't that much, but I actually do on the people that I talk on this podcast. I put a little piece of tape on the back of her left knee just to take out the hyperextension. So when she bends forward, it's not pulling on it. It's basically, I unloaded part of her nervous system, and I just did it on the left knee, the posterior part, because that's where her symptoms were.
Mm-hmm.
And that she bent forward, she felt much better with the tape. I sent her on her merry way. And that was that.
Beautiful. All you did was give her some sensory input to
Right.
come out of hyperextension, which is
Right.
going to quit pulling on the nervous system so hard, which lessens her symptoms.
Exactly.
So what it sounds like to me is that using neural tension techniques, only this time the target was the dura, to desensitize the dura, and you were doing it from above and below.
Correct.
And I think that's great. So I just have to ask this question because I'm intrigued about the power outage on the stairs.
Yes.
I would love to watch her go up and down the stairs, because I bet you $100 she flexes her head down to see where she's going.
Oh, that's a great point. I didn't check her stairs. That's a great point.
I'm just wondering
I'm sure
if she would like straighten up on the stair, if it would be better.
Ooh, you know what? It's a great idea.
Yeah. That's the only thing I would be interested to see. But I have the ability to sit here and listen and, fly at 10,000 feet while you were in the trenches, kind of going, what am I going to give her to do so that she has something to do that's positive as she walks out the door, and they'll quit taking her someplace to get her leg pulled on.
Yeah, I will email the mother actually because that's actually great, because it's so funny, because I was getting things better in. I have a small, did I say stairs? No, I may have had her do a step up, but that was not good. And I needed to get her in a stairwell. And in New York City, the stairwells have to go, we're an elevator city here. So, but that's a great idea. And I will actually email the mom, because they're going to come when they can, basically.
Yeah, exactly.
So I'll say if it's still bothering up the stairs, have her look up. It's a great idea, and I think that's a great idea, and I'll have her do that.
Mm-hmm.
Because everything that was positive was winding up that whole system.
Mm-hmm.
You know, and I think for her, I mean, and she's young, and I think with the right therapy, she'll get better quickly. I mean, if not better already, to be honest, knowing how much better she got with the knees, with the foot. I mean, 3 visits and she goes to Italy and she's fine and she's playing volleyball. I mean,
The
if we could
resilience of
only heal.
kids.
I know. Darn, if I could
And
only.
quite frankly, just by, getting her nervous system moving a little bit different and acknowledging it, she probably cleared up most of it. But it'd be interesting to see if she was still having trouble on the stairs. But I would bet definitely $100 that she was, dropping her head to look at her feet as she goes up the stairs, or looking down at we do that. That's kind of a human thing. We kind of look down a little bit as we go up, rather than, maybe you'll look up a couple of times to see where you're going, but you kind of just look straight ahead at the stairs almost, or maybe even a little down. It'd be interesting to see what her strategy was, because I wonder if that's what was, because that would make sense. That's the slump test position.
Yep. And I know exactly. And in school, she probably has some stairs to do. Most kids do. I mean, they can't take elevators.
And a backpack.
Yes, exactly.
So
and
she's
small,
loaded.
and she's small,
Yeah.
Yep,
and she's loaded, so there it is. Bigger step, has to travel farther for the step, and she's loaded up while she's doing it.
You almost wonder, because I do see a fair amount of children, and because of their schedules during the school year, they need to come in more than once, unless they're playing an active sport, which, this is more of an intramural thing with her, but it's hard when they're just going to come in for one visit, because you want to do so much, and you can't, because you need to give them something to do, not quickly, but something that you think will give you the most bang for your buck. And I almost want to like bring her back in and have her do some stuff with the stairs. But I'm going to email the mom, and so I guarantee you she's looking down. Knowing her, she's looking down. So because she's so small, so. I will actually report back on another podcast, because that would be very interesting. And I think the beauty of this is that, the classic hamstring tests were just, and not really positive. I mean, if someone's lacking power in their hamstring going up the steps, and they can do a prone hip extension and a glute max, no problem. It's not the hamstring. That's my personal opinion. At least it's not 100% the hamstring.
Mm-hmm.
So
absolutely.
And then the only reason I taped her was just, as you said, to take some pressure off part of the dural tube.
Something to do, something to change up the sensory system.
Yep.
And it's a lovely sensory reminder, like, the brain just says, don't go there because that pulls on the skin. Okay. Mm-hmm. It's not really a fix, so to speak, but it is a nice sensory reminder for her to just move in a different pattern.
Yep.
So that she's not moving in the same pattern over and over again. That's become a bit sensitized.
Yep, exactly. So I will keep everybody posted on her, since it was just one visit, and I think that may be the only visit. So, but if she does come back and I get the mother emailing me, I will report back. So that's that. I hope everybody enjoyed it.
Okay. Leave us your feedback. Leave us your questions. Find us on our website, www.toughtotreat.com. We've got some great opt-ins coming, so be sure to sign up for our newsletter to get our free opt-ins. And
I'm going to post the video of the foot, I know I keep saying that, but I just, I had a book launch recently, so I've been a little bit over busy, but I will get that out, I promise.
Yes.
Anyway, thanks, guys.
Yep. We're going to be putting more videos up on our website as we go forward, too. So stay tuned, and we'll see you next time.
Right. Bye.
Bye.